Our next bacteria is Clostridium Botulinum, and we're going to talk about what Clostridium Botulinum is and what it does. Its unique exotoxin is the botulinum exotoxin, and that's going to cause most of the problems you see with botulism. What does botulinum toxin do? It binds to the presynaptic nerve terminal and prevents acetylcholine release at the neuromuscular junction. So you're preventing acetylcholine release. So all the problems relate to decreased acetylcholine. So if you don't have acetylcholine, you cannot have binding to muscarinic and nicotinic receptors. So muscarinic receptors do all your glandular activities like tears, saliva, sweat glands, smooth muscle, and nicotinic does your skeletal muscle. So you'll have problems with both of these. Decreased tears, decreased saliva, decreased sweat. Smooth muscle can no longer relax, so it will contract. Nicotinic problems. Skeletal muscle, what will happen? Right, it will be hypotonic, so you cannot contract your muscles anymore. So now let's talk about botulism. What exactly is going on with botulism? So, botulism in adults, you have ingestion of already formed toxin. So it's foodborne, and the toxin is already pre-formed. So you're not ingesting the bacteria, you're ingesting the toxin. Alright? So what does this cause? A descending flaccid paralysis. Remember, this is a nicotinic receptor blockade. Not really nicotinic receptor, but it blocks acetylcholine release from the presynaptic nerve terminal, preventing binding to nicotinic receptors. So you cannot have contractions. What do you get? Flaccidity. So you get a descending flaccid paralysis, and it's associated with improperly canned foods. So if you have foods that are not canned appropriately, botulism is a possibility that can happen. Babies, on the other hand, ingest spores, and the spore ingestion leads to germination inside the GI tract and the problems that we see. This is why you avoid honey prior to 12 months of age in babies. And what happens is that these spores get ingested, go to the GI tract, colonize and germinate, and create toxin. And that's what causes all the symptoms you see. It's called floppy baby syndrome due to the flaccidity of the head. Another important thing, though, is even though honey is a very common risk factor, the most common reason to get it is environmental dust and soil with Clostridium botulinum spores. So in the U.S., actually, the most common reason to get botulism for infants is because of environmental dust and soil. So what are some clinical manifestations that differentiate it from Guillain-Barré? So the first thing is that there's no fever. Guillain-Barré doesn't have to have a fever, but it might. This never has a fever. It's all due to the toxin. Symmetrical neurologic deficits. So the deficits happen in tandem with each other on both sides of the body, as opposed to Guillain-Barré. And there's no peripheral sensory deficits except for blurry vision. So it doesn't usually affect your sensory nerves. It mostly affects the skeletal nerves and the muscarinic the tissues that have muscarinic activity, also the parasympathetic nervous system. But you won't have sensory deficits except for just some blurry vision in the eyes. Infantile botulism, you have constipation, so it goes into the GI tract and the toxin inhibits the smooth muscle, preventing it from being able to contract, leading to weakness, poor feeding, hypotonia, and drooling because of lack of function of the GI tract, and also because you have a descending paralysis, so hypotonia of the muscles, drooling because you lose the muscle function in your face, and poor feeding for that same reason. So now foodborne botulism, the one that happens in the adults due to improperly canned foods, it starts within 1 to 5 days. So within 1 to 1.5 days of ingesting the toxin, that's when you'll get these symptoms. And these initial symptoms are pretty vague in general, including vomiting, diarrhea, and abdominal pain. But then you get cranial nerve involvement, and that's a classic feature of botulism. Botulism will have the cranial nerves involved, so what do you get? You get blurry vision. Why? You've lost the parasympathetic nervous system, and you lose the skeletal muscles that control the eye. So if you have problems with the muscles controlling the eye, you will get blurry vision because you need the muscles controlling the eye for proper eye movements. And without the parasympathetic nervous system, you can't accommodate and you get blurry vision. Fixed and dilated pupil, you get a dilated pupil because you inhibit this parasympathetic nervous system, and it's also fixed because all the muscles are paralyzed. Nystagmus, ptosis, dysphagia, dysarthria, facial weakness, all of these are due to problems with muscles in the eye or in the face or in the throat. So you get descending weakness after the cranial nerve involvement, starting with the trunk, then going to the upper extremities, and then finally reaching the lower extremities. So it follows this pattern. And the most severe complication is respiratory failure if the diaphragm gets paralyzed. Especially if you have phrenic nerve involvement, you get respiratory failure. Smooth muscle paralysis can also occur too. Remember, muscarinic receptors, they supply the parasympathetic nervous system, so you can get urinary retention and constipation due to the smooth muscle paralysis. Very important things to know. So how are we going to diagnose this condition? Infant botulism, how do we diagnose it? We check for toxin or spores in the stool. Remember, we talked about how the infant ingests the spore, and the spores germinate into Clostridium botulinum and make more spores that will be in the stool and toxins that enter the body. So you can check for this in the stool. So while awaiting the stool studies, you can confirm the diagnosis with Emg findings. Remember, the skeletal muscles are being affected, so you'll have some Emg findings for infantile botulism. Now for foodborne botulism in adults, you detect the toxin in the blood. Because remember, the toxin is causing this disease. It's a preformed toxin. Now you get some Emg findings here. Why do you get excessive action potential, small wave amplitudes, and bursts of low wave voltage motor activity? The reason why is that you have inability of acetylcholine to bind to the nicotinic receptors. So you have excessive action potentials in the presynaptic terminal trying to overcome this blockade. So remember, action potentials lead to muscular contraction. If you have action potentials that don't lead to muscular contraction, what's the body going to do? Make more action potentials to try and cause a muscle contraction. But because there's no acetylcholine being released, it doesn't work. Small wave amplitudes and bursts of low voltage motor unit activity because of the muscles not getting much acetylcholine binding and very low amplitude activity in low voltage motor units. Treatment. No antibiotics are needed. Remember, this is caused by the toxin. So what do you need to give? Hospitalization and monitoring of the patient, so you watch out for respiratory failure and diaphragmatic paralysis. For children, you give the antitoxin. All right, very important. Greater than 1 year old or adults, and you give the antitoxin. Remember, in the adult form of botulism, you get toxin causing the problem. Same with babies that are older than a year old that eat honey after a year of age. They're going to get the foodborne botulism, not the honey kind. Only if you have the young baby that gets the honey or environmental dust-induced botulism, that's when you give the human-derived immune globulin. So for adults and kids older than 1 year old, you give the antitoxin. For kids less than a year of age, you give the botulism-derived immune globulin. So now let's talk about Clostridium Perfringens. This is the next one on our list. This one causes Clostridium myonecrosis, or gas gangrene. So we talked about myonecrosis when we talked about Streptococcus pyogenes. Now this is a different form called Clostridium myonecrosis, and this is usually secondary to trauma and seeding of the bacteria into the muscle or into the tissue that it's going to be causing the damage to. So you have a severe muscle infection and destruction that can cause elevated CK levels, creatinine kinase, and can even cause death. So this is a very major infection, as you can see here. So how does it happen? Some kind of traumatic injury that's penetrating into the skin causes spore implantation into deep tissue, especially into the muscle. So some examples of this are knife wounds, gunshot wounds, and crush injuries. And in all these examples, you've got spores implanting into the tissue. So knife wounds, gunshot wounds, crush injuries, you have spore implantation, and they can germinate and cause all the problems. Because these injuries cause problems with the vasculature, you lose the oxygenated blood supply due to the vessels being damaged, and that creates a nice anaerobic environment, allowing the Clostridium perfringens to grow and cause problems. The infection here is mediated by alpha toxin. So what does alpha toxin do? It causes muscle necrosis, and there's no PMNs in the infected tissue. And why is that? Because the toxin is a phospholipase C and a sphingomyelinase. They damage membranes, and they also inhibit neutrophils from leaving the blood vessels and entering the tissue. So this Clostridium perfringens can sit around causing damage and killing everything at once without any immune system response because they can't leave the blood vessels. Pretty smart bacteria we have here. Necrosis progresses within 24 to 36 hours after trauma. So it happens usually within 1 to 1.5 days after the trauma occurs. What is the clinical presentation? Sudden onset of severe pain at the trauma surgery site, 24 to 36 hours later. So severe pain, sudden onset. Skin color changes from pale due to loss of vasculature to purple and red because of the toxin and the bacteria growing and causing so much damage. It's tense and painful. Remember, you're getting severe damage and the neutrophils cannot come from the vessels and attack the bacteria. So it can grow and cause so many problems that it can even cause systemic toxicity and cause cytokines being released, leading to fever, tachycardia, and shock. And the bacteria can even enter the blood and go circulate to other places. You even get muscle necrosis. And when you get muscle necrosis, you get myoglobin in the urine, leading to renal failure. And the major reason for systemic toxicity is all these neutrophils sitting around in the blood vessels can start secreting cytokines, leading to tachycardia and shock. And you also have, because this is an anaerobic bacteria, it produces gas, and that's going to cause crepitus in soft tissue. That's a really important physical exam finding. Diagnosis. Gas detection by CT, MRI, or blood cultures. You can tell this gas detection by these mechanisms and do a blood culture to detect the bacteria. You can also do surgical expiration. This is much more important in high yield, especially in a very severe condition such as this one. You want to open up the wound and expose these bacteria to oxygen so they can die. Edematous, red-black discolored muscle because of the infection and the destruction of that muscle. What are some treatment options? Surgical debridement. You want to clean up the wound and remove all the bacteria and all the spores and all the dead tissue, which are allowing the bacteria to survive. And also empiric antibiotics. Piperacillin tazobactam in case there are any gram-negatives found here or gram-positives, and clindamycin for the anaerobes, such as the Clostridium. Tetanus immunization. Remember, we had a penetrating trauma, so based on the guidelines we know about tetanus, we'll have to give tetanus immunization if necessary. Now we'll talk about the food poison that's caused by Clostridium Perfringens. What happens here is that the spores germinate in undercooked food, such as meat, poultry, and gravy. And unlike the toxin ingestion in Clostridium botulinum, in Clostridium perfringens, the adults actually eat the actual C. perfringens, and that ends up in the GI tract and produces toxins. So you're actually ingesting the organisms here. Symptoms occur pretty rapidly within a day of ingestion, and you get watery diarrhea, abdominal cramps, and abdominal distension due to gas. So severe watery diarrhea with a lot of cramping abdominal pain. How are we going to diagnose this? We test the food or stool for toxins so we can see what the cause was. And overall, we don't need to give any antibiotics for treatment. We just need to give supportive care and give fluids and rest because it's going to go away within 24 hours. How are we going to prevent this? Prevention is absolutely necessary by refrigerating and reheating the leftover food, especially meat, because you will kill the bacteria if you reheat the food. But if you don't reheat it or refrigerate it, you're setting yourself up for an infection.